Hey everyone, Michael Dudley with In Good and Health. I have an awesome patient success story to share with you today between our care navigator Lisa and her patient Jane Doe. Their health is complicated. There are a lot of different factors, and that's why it's so important to have one person you trust to help navigate all of them. You might be thinking to yourself, navigate all the health factors? What are you talking about, Michael? Well, studies have shown that clinical care, what we consider health care, only accounts for about 20% of our health, with socioeconomic, health behaviors, and physical environment accounting for the other 80%. This is why our care navigators really focus in on listening to the patient, understanding their living situation when it comes to tying in that care plan to solve for a health need. So in 4 short months, Lisa's already helped Jane overcome a number of these health factors. Just in the very first month, Lisa learned that Jane was having some food insecurity issues. She offered to help, but Jane was reluctant. Finally, Jane let Lisa obtain Meals on Wheels for her. She loves the food and tells Lisa she looks forward to seeing those happy, smiling faces every time they come to her door. And now that Jane knows that she has someone she can trust and that Lisa's just trying to help, they're just getting started. Now, Jane lives alone in an apartment. She's lived there for 50 years. In fact, her grandmother used to live across the street when she inherited a few items a number of years ago. So last month, when Lisa got the sense that Jane might be a collector of sorts, she asked Jane if she could walk in her home, which Jane replied that she did have a pathway that she could get through. Now, for a care navigator, identifying a patient's safety and if they could be a fall risk due to physical environment is just one of the important tasks that a care navigator tries to focus in on. So Lisa asked if she had a problem keeping things and not being able to let them go, which Jane replied yes. In fact, Jane opened up a little bit more. She mentioned that the landlord had actually asked her to get rid of all this clutter, but had been nice about it and told her to take her time and even brought her some boxes. So Lisa offered if Jane would allow her to call Goodwill on her behalf and have someone there come and help her sort through her things. But Lisa said she was too embarrassed to have people go through her home. So they talked about working through a plan. Well, just yesterday, Monday, when Lisa called Jane, she asked how the cleanup and how the decluttering was going. Jane says, "It's going well. I now have a pile of things to donate, including some of my grandmother's things. I know this will help another family, and my grandmother's things will be loved again. I never would have done this without you. Thank you so much, Lisa." So the reason I love this story is obviously it ties in all those health factors, but it's one of those things where without that trust, she would have never opened up. And I think that's really where a care navigator kind of is different from a physician and what happens within the 4 walls of a practice. They're not always able to take the time and focus in on all these other socioeconomic issues, health behaviors, physical environment that a care navigator is able to do. So if you'd like us to be able to repeat the same success with your practice, with your patients, we'd love to do so. My information's in this description and would love to be able to get in touch with you. Thank you so much. Have a great day.